Sirolimus, also known as Rapamune, is used in combination with other medications to prevent the rejection of a kidney transplant. This medication falls under the category of immunosuppressants and works by weakening the body's defense system, also known as the immune system, in order to help the body accept the new organ as if it were its own. It may also be used to treat a certain lung disease called lymphangioleiomyomatosis, or LAM. The daily dosage of Rapamune will be determined by your doctor and is usually taken once or twice a day. It is important to take this medication at the same time each day. It can be taken with or without food, but it is best to be consistent in how you take it. Be sure to follow your doctor's instructions carefully for the best results. Remember, this medication is prescribed specifically for you, so do not share it with others. Before taking Rapamune, make sure to read the medication guide and instructions for use provided by your pharmacist. Always ask your doctor or pharmacist if you have any questions. Take this medication by mouth as directed by your doctor, usually once daily. If you have nausea or an upset stomach, you may take this medication with food. However, it is important to choose one way, with food or without food, and take this medication the same way with every dose. Use the provided amber oral dose syringe to carefully measure the dose. Do not use a household spoon. Mix the measured dose with at least 2 ounces of water or orange juice in a plastic or glass container. Drink all of the mixture right away and then refill the container with at least 4 more ounces of water or orange juice and drink it right away. Do not prepare a supply in advance. The oral dose syringe should only be used once and thrown away. Use a new syringe for each dose. The dosage is based on your weight, medical condition, lab tests, and response to treatment. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Do not increase your dose or take this medication more often than prescribed. Also, do not stop taking this medication without consulting your doctor. If you are also taking cyclosporin, take sirolimus 4 hours after your cyclosporin dose. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely. Grapefruit can increase the chance of side effects with this medicine. If you are taking this medication to treat LAM, tell your doctor if your condition worsens. Some common side effects of Rapamune include diarrhea, joint pain, shaking, acne, and trouble sleeping. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. Additionally, it's important to remember that this medication has been prescribed because the benefit to you is considered greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as nausea or vomiting that doesn't stop, yellowing of the eyes or skin, dark urine, muscle or bone pain, increased thirst or hunger, frequent urination, hearing problems, unusual tiredness, changes in heartbeat, easy bruising or bleeding, mental or mood changes, swelling, severe headache, dizziness, stomach or abdominal pain, missed or heavy periods, signs of kidney problems, or pain. Redness, or swelling of the arms or legs. In some cases, Rapamune may increase the risk of a rare but serious brain infection known as progressive multifocal leukoencephalopathy, PML. It's important to seek medical help right away if you experience symptoms such as clumsiness, loss of coordination or balance, weakness, sudden changes in thinking, difficulty talking or walking, seizure, or vision changes. It's also important to note that Rapamune may slow wound healing after surgery, and the risk of poor wound healing is higher for individuals who are obese. Additionally, the medication may cause an increase in cholesterol and triglyceride levels, requiring periodic monitoring and potentially the use of additional medication to control these levels. Lastly, while a rash is a common but usually not serious side effect of Rapamune, it's important to seek medical help right away if you develop any rash, as it could be a sign of a severe reaction. And while very serious allergic reactions to this drug are rare, it's important to get medical help immediately if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And if you are in Canada, you can report side effects to Health Canada at 1-866-234-2345. Sirolimus, also known as Rapamune, works by lowering the body's ability to fight off infections and diseases, which is known as immunosuppression. This means that it may increase your risk of developing an infection or certain types of cancer, such as skin cancer and lymphoma. To reduce the risk of these serious side effects, it's important to take this medication at the lowest effective dose as directed by your doctor and to keep all medical and lab appointments. If you notice any unusual skin changes, changes in the appearance or size of moles, unusual growths or lumps, swollen glands, night sweats, unexplained weight loss, or signs of infection like a sore throat that doesn't go away or a fever, it's important to tell your doctor right away. It's also important to note that sirolimus is not recommended for the prevention of rejection of liver or lung transplants because it has rarely caused very serious, possibly fatal, liver or lung problems in those cases. Always follow your doctor's instructions and ask about the best time to take this medication and the recommended daily dosage. Before taking Rapamune, it's important to let your doctor or pharmacist know if you have any allergies to sirolimus or temsirolimus, or any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Make sure to inform your doctor or pharmacist about your medical history, especially if you have liver disease, high cholesterol or triglyceride levels, cancer, or any recent or current infections. Rapamune can increase your risk of getting infections or making current infections worse, so it's important to avoid contact with anyone who has an infection that can easily spread, such as chickenpox, COVID-19, measles, or the flu. You should also talk to your doctor if you have been exposed to an infection. Before receiving any immunizations or vaccinations, be sure to tell your healthcare professional that you are using Rapamune. It's also important to avoid contact with people who have recently received live vaccines, such as the flu vaccine that is inhaled through the nose. Using this medication may also increase your risk of developing skin cancer, so it's recommended to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are male, Rapamune can affect fertility, so make sure to ask your doctor for more details. If you are pregnant or planning to become pregnant, it's important to talk to your doctor. You should not become pregnant while using Rapamune, as it may harm an unborn baby. Ask about reliable forms of birth control while using this medication and for 12 weeks after the last dose. If you do become pregnant, discuss the risks and benefits with your doctor right away. Finally, if you are breastfeeding, it's important to know that Rapamune may pass into breast milk and could have undesirable effects on a nursing infant, so it's not recommended to breastfeed while using this medication. Be sure to consult your doctor before breastfeeding. When taking Rapamune, it's important to be aware of potential drug interactions. Certain medications, such as ACE inhibitors and other drugs that weaken the immune system, may interact with Rapamune. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, some medications can affect the removal of Rapamune from your body, which may impact how it works. Examples of such medications include azole antifungals, macrolide antibiotics, and HIV protease inhibitors. It's important to consult with your doctor before starting, stopping, or changing the dosage of any medicines while taking Rapamune. And remember, do not use medications containing temsirolimus while using Rapamune. For the best results, always follow your doctor's advice regarding the daily dosage and optimal timing for taking Rapamune. If someone has taken too much Rapamune and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. During your treatment with Rapamune, your doctor may conduct various lab and medical tests to monitor your kidney and liver function, cholesterol and triglyceride levels, as well as urine tests to check for protein and sirolimus trough levels. Make sure to attend all your medical and lab appointments as advised by your doctor. If you have undergone an organ transplant, it is important to attend a transplant education class or support group to learn about the signs of organ rejection, such as feeling ill, fever, or experiencing tenderness or pain around the transplanted organ. If you notice any of these signs, it is crucial to inform your doctor immediately. If you forget to take a dose of Rapamune, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at your usual time. Don't take a double dose to make up for the missed one. It's important to take Rapamune at the same time every day to keep a consistent level in your body. When storing Rapamune, it's important to keep it in the refrigerator, away from light, and in an upright position. Make sure not to freeze it, but if necessary, it can be stored at room temperature briefly. Check the product package or ask your pharmacist for specific storage instructions. Once the bottle is opened, the medication should be used within 30 days. If stored in an oral syringe with the cap on, it should be used within 24 hours. Avoid storing it in the bathroom and keep it away from children and pets. If the medication develops a slight haze when refrigerated, let it stand at room temperature and shake gently until the haze disappears. This haze does not affect the quality of the drug. When it comes to disposing of Rapamune, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.